Maybe there's a financial barrier with going to the doctor. What do you want people to know about making sure they take care of themselves?
So one of the things we look at when you look at the disparity with black men's health, as a matter of fact, when you look at the data from the CDC, black men actually lags about 4 or 5 years to die younger than white men. Black women, however, live much longer than black men. And the reason why we're seeing this is because of the phenomenon called allostatic load, which is a cumulative effect of stress over both mental and physical health. And when you look at black men in particular, we think about structural racism and the way it's set up that, shall I say, provide persistent stressor. The longer you're in a state of persistent stressor, what happens then is physiologically you start having some changes. So black men tend to develop chronic health conditions 10 years younger than any other race. And that's the reason why we see less life expectancy in black men.
We were just talking about in March the rise in colorectal cancer and prostate cancers and things like that, especially in men, because they just simply don't go to the doctor.
Yeah.
Are these simple things that can be treated and prevented before you get to that point?
That's what we always say, prevention is better than cure. The most important part is to realize is the advances in medicine right now allows us to cure and adequately treat medical conditions if they identify early, especially cancer. For black men right now, colorectal cancer is one of the leading causes of black men. And about 15% of black men that develop colorectal cancer will die. Why? Because one, by the time it's diagnosed, it's a late stage cancer, which has the worst prognosis. If you do preventive care by doing your, yearly rectal examination or yearly colorectal screening, they make it more simplified right now with pills that you can take that take pictures of your GI tract, just checking for blood in your stools. And also you have to watch patterns of your bowel and see if there's any changes. If you notice any of this is when you want to seek a doctor and seek guidance as to what to do. Well,
really quickly, tell me what's going on this month and how can people get involved?
Yeah, basically, for the first time, we've decided to launch the Fully Alive Men's Health Summit. For the whole month, we'll be having curated events specifically for men. The first event is on June 1st, and on that event, we'll be discussing the state of black men's health, almost like a state of the union for black men's health. We talk about the things that's making black men die younger, what black men needs to know to stay healthy and live longer, to be part of a contributing part to the community, and be able to be around to raise their kids, and at the same time provide tools that will allow black men to thrive and just feel fully alive. And subsequent weeks in the month, we talk about diet and nutrition, because one of the best ways to stay healthy is to eat right.
Yes.
So we'll partner with Ebony Nutrition Consultant downtown Orlando, where we have like lifestyle demonstration, live demonstration of cooking, healthy cooking for healthy lifestyle.
And really quickly, and I know we've run out of time, but I want to make sure that people know this. This is 100% free,
yes.
And you'll be able to answer some of the questions that
yes.
people may have that log on. We've also posted this event for you if you want to find out more information on our community page on WESH.com. There you'll see all the different events, the different topics that are going to be discussed. And Doctor, we're going to have you back next week on WESH 2 News Sunrise to give us more details about what's coming up for next week.
Yes, thank you very much for having me. I really appreciate it.
Thank you so much for coming in.
Thank you.
Michelle and Tony?